Hello, my name is Camden Gordon. Today I'm going to be giving you a presentation on osteoporosis. Now, to give a brief overview or introduction, for lack of a better term, osteoporosis is a silent disease, and it's basically a disease where it infects the bone and the bone density over the course of time is reduced. This could lead to a plethora of different health issues, um, but for now, we're just gonna stay on the lines of just osteoporosis. There's two different forms. There is senile, and then there is post menopause osteoporosis. Let's start with post menopause. This one, you obviously affects women, um, and with this, it's going to be the reduced amount of estrogen in the body will lead to this form of osteoporosis. A reason for this is because there isn't as much calcium in the body, and we all know calcium is good for the bones. And because of this, it's just a compounding effect of which will lead to osteoporosis. Now, the other one is called senile osteoporosis. That can happen to anybody, and that's when the osteoblasts in the body, there's osteoblast and then there's osteoclast. Osteoblast build, and then osteoclast break down the bone. So with senile, with senile osteoporosis, the body basically the osteoblasts are not as efficient or not as capable as before in regards to building back the bone, and then the osteoclasts are still doing their thing, so they're still breaking it down, um and like that's what they're supposed to do, but because we're not having enough bone being reformed, that's where the problem lies and how we can lower bone density, so on and so forth. So that is basically the breakdown of how osteoporosis works in the two different forms within osteoblast, osteoclast. Also, there is it affects it can affect everybody, but there is more specific demographics, as in there's Asian women, well, women in general and Asian women have a higher risk of developing osteoporosis. Also, like I said before, women post menopause, they have a higher risk of developing osteoporosis, and it's a fairly common disease. It actually affects 3 million cases per year in the U.S. Well, there's 3 million cases per year in the U.S. of osteoporosis. So trying to combat it is like very helpful and useful, especially if you can get it early. It will help a ton later in life. Now, let's go to okay. So for the risk factors, there are a few. We talked about some, but I'll go over them again. First is sex. Women are more likely to have it than men, but men can and will still get it. Then age. The older you get, the less production you get out of your osteoblast. So, of course, with age, you'll see a lower amount of bone mineral density, and this usually occurs around the seventh, eighth decade of life. Then we have race, like I said, white and Asian women are at a higher risk of developing the disease. We have family history. If anybody in your family has, immediate family at least, had or has osteoporosis, your likelihood it just shoots up through the roots of getting it. So if you do have family in with this condition, you definitely want to take precautions before anything happens to combat the disease. Drink your milk. Also, body size. So when dealing with osteoporosis, sorry, when dealing with osteoporosis, smaller bodies will tend generally be better, because if you have a bigger body, the likelihood of you falling is higher. So when you fall, you can fracture bones, which would not be good for your bones in general, since they already have a low bone mineral density. They have a hard time healing. There's a whole bunch of health issues that come with that. So we definitely want to reduce the weight. Plus, ideal weight for anybody is always good. So we're always going to promote weight loss if needed. Now, there's more risk factors that are more direct towards osteoporosis. For instance, one of them is hormones. Low sex hormones tend to weaken bones. Also, again, low levels of estrogen in women will weaken bones. There's also thyroid issues. I'm sorry, I'm running a blank. Oh, too much thyroid in the bone can lead to bone loss. Um, we also have GI surgery. We talked about that in class too. Well, you talked about it, Dr. Sowers. Reducing reducing stomach limits. Reducing the stomach limits the amount of nutrients absorbed. So that could be a very big factor in regards to dealing with osteoporosis. And some of the things that we don't want is no alcohol is great, but as minimal as possible is ideal for somebody dealing with osteoporosis. Also, smoking. Like, then again, it's not good in general, but smoking, you definitely want to avoid it because it will have negative effects on your body, obviously, and especially in regards to osteoporosis. Okay, so the pathophysiology, right? So with osteoporosis, we're gonna have a decrease in the spongy and the cortical bone, which will lead to a reduction in bone health. Now, with the spongy bone, due to the reduction in the spongy bone, there's going to be a reduction in the trabeculi within the spongy bone. Think of the trabeculi as like the support structure. So think about it. If you have a reduction in the support, the bone mineral density going down, your bones overall are just not as strong. That could lead to falls. We don't want falls, right? Again, low estrogen after menopause. This is one of the big factors aiding in osteoporosis, especially in older women. Then we also have a vitamin D deficiency, and all of these symptoms can progress to fractures. Now, like I said before, having to do with the trabeculi, the likelihood of what's the word I'm looking for? The likelihood of dealing with any fractures in regards to osteoporosis is a lot higher because the bones are so weak, the likelihood of falling is higher. And when we fall, we're mostly going to break something again because the bone is so weak. So, and we all know that, especially with older individuals, falling is just not it. We learned about some of the stuff in class where that's like basically a one-way ticket into a nursing home. And older people, they want their freedom, they want stuff like that, so we want to avoid that at all times. Some of the bones affected would be the vertebrae of the spine, also the ribs and the scapula, especially the spine. When the bones get too weak, they will fracture and then sometimes shatter. And if we have a shattered vertebrae, yeah, you're not gonna be alone for the rest of your life. You're gonna have to have somebody with you, surgery, a whole bunch of health issues that we don't want to deal with. So let's get past the negative and talk about some things to help with osteoporosis. So one of the main things is exercise. It's about the class. Exercise will help tremendously in regards to osteoporosis. It what's the word I'm looking for? It will aid in the reduction of loss in bone mineral density. If you understand, I'm sorry, bad choice of words. But yes, it will slow down the loss of bone mineral density. Um, and if we're slowing it down, eventually that's just great. That's what's great for this clientele. Now, because another thing that our exercise will do is it will increase balance. Now, like I said before, if we're increasing balance, we're improving balance, that means the likelihood of falls are a lot less. Now, if that's the case, that means we can be on our own for longer. That's basically the gist. Like, we, as an older person, you want to be able to be self-reliant, so we can be on our own for a lot longer. So the for the ACM guidelines for osteoporosis are pretty basic in regards to, like, if you know about a disease, things that you shouldn't do. Um we want we want them to be weight bearing, but we have to be very careful with this population. We don't want any, like, forward bend or twisting movements. Basically, we don't want to put any undue stress already on the body that that could possibly aid in an injury. So there's a few different things. Like, for instance, aerobic, we have 4 to 5 times a week with a moderate intensity. On a scale of 1 to 10, it's gonna be around 3 to 4. Again, we're not trying to make elite athletes. We just want them to be active. Resistance, you gotta start with around 1 to 2 days per week, gradually increase. We're gonna keep the weight low. We're gonna keep the intensity relatively low towards the beginning, depending on the patient. Flexibility is big. You want to be doing flexibility a lot, almost every day if you can, to be honest. Flexibility will aid in balance. Balance will aid in the reduction in falls. Less falls, less fractures, less fractures, less health complications in regards to the disease overall. Next. Now, precautions. I kind of went into a little bit before, but I'm gonna reiterate it. We have to be very careful when exercising with this population. So, like I said, any forward bending or twisting of the spine, no go. Avoid anything above the shoulder. Also, high impact stuff like jogging, skipping, jumping, anything like that, no go. They're obviously patient specific, but in layman terms, yeah, we don't want to do that. Too much impact on the joints. It's just not a good time. Not a good time. Again, because they're exercising, they do have a greater risk for falling. So you really want to be watching them. We got to be watching them all the time, but especially during exercise. Also, because of osteoporosis, there also could be other health conditions like arthritis. So we want to tailor the exercise program or modify it in any way to help with those other health conditions. Next slide. Okay, so why is exercise important? Number one, it's good for you. We all know it. That's all the permanent. It's good for you. Everybody should be exercising. It doesn't hurt. But a few main things is going to be a reduction in bone loss, bone mineral density loss. It's going to help maintain the bone that we have now. So the bone that the said patient has at the moment. With osteoporosis, rebuilding the bone is the goal, but it's sometimes not always the outcome. So we want to prolong the good bone for as long as possible. So exercise is great for that. It will also increase our range of motion. Increased range of motion for anybody is great, especially in the older population, or anybody dealing with the disease in general. Again, it will reduce the chance of fractures. Also, it's going to be overall better physical fitness. Like I said, this population is usually older. They have a lot of health conditions. Being physically active is great for them. And we want to prolong that for as much as possible. Also, muscular strength. Again, self-explanatory. It's gonna help them in every way. Exercise will help them. Exercise. Now, for the conclusion. Like I said again, osteoporosis, it is a silent disease that affects the bones. Your bones are going to overall be weaker because of the osteoclast doing what they do and the osteoblast not doing enough of building. So we definitely want to, again, if you can catch it earlier, the better, because then we can take steps towards fixing it and reducing the amount of bone lost over the course of time. We're looking for about 150 minutes of moderate activity and then 75 minutes of vigorous intensity. That is all patient specific. So the trainer will obviously tailor the program towards said patient at the time. I said it again, but another big thing is balance. We really want to focus on balance. Osteoporosis is bad. There's a lot of health conditions or health complications that come with it. But the number one thing is fractures. If we can improve their balance and improve their muscular strength, the amount of fractures that can take place will be significantly reduced. And that is great. That is great. For anybody in general, to be honest. Like, fractures suck. So doing that will 100% help them in every way. More of the story: exercise, exercise, exercise. Be careful when you're exercising, though. You want to take the necessary precautions.